Once again, welcome to this afternoon session. I'm Manga and I'll be taking you through this afternoon's discussion. And this afternoon we'll be talking about protecting our health workforce. And with me I have the Minister of Health and Social Services, Dr. Kalumbi Shangura, as well as the WHO country representative, Dr. Charles Sagu Moses. And before we go to the discussion, Dr. Shangula, do we have any news on the current situation of COVID-19?
Yeah, thank you very much. Yes, at the COVID front, there is always news. And today, there is no news apart from that which was shared within the morning. And sometimes they say no news is good news.
Thank you very much. Okay, now we are discussing about protecting our health workforce. Dr. Shangula, how important is that?
The biggest asset in any organization is the personnel, is the staff, is the people who are doing the work. That's the biggest asset. And therefore, it is very important that that asset is protected and is taken care of. There are many ways of ensuring that the staff has got the ideal environment and also that they have the necessary equipment to work with. As we are in the era of COVID-19, the statistics have shown that a number of health personnel, they become sick, they contract the virus in the process of helping the patients. The number of those who get infected ranges from country to country, and we have heard that a high death toll in places like Iran, in places like Italy, where a number of health personnel have died. But coming to their protection, the first thing is that this workforce, you must have them in sufficient number. You must have them in the number that is required for them to carry out the work very optimally. If they do not get enough rest, if the workload is very high, then it can result in burnout. Now, when they are burnout, they are likely to be less effective and they are likely to make more mistakes to the detriment of the patient. Therefore, the first thing to consider is to make sure that they are in a very good physical and mental condition, because they are not required to work long hours than is humanly possible. That's number one. The second point is that they must have sufficient training. During the training of health workers, whether it's a nurse, whether it's a doctor, they are also drilled in infection control. That's now during the training, and it's very, very important that during the training they master the arts of infection control. Because when they are coming into the work environment, they may not have the luxury to be properly inducted. But it's also the responsibility of the employer to ensure that any new worker is properly drilled in the infection control in order to protect that particular individual. The other point which one can also mention is the risk reduction. In other words, the person should work in an environment where it's not so much exposed to contracting of infection. It is very essential that what we preach to others we should also practice ourselves. A health worker is supposed to be acquainted very well with the matter of infection control, so that is able to pass on this knowledge to the patients, to the clients. Elementary things like washing your hands, using of protective equipment when you are in a risky situation. But also one important thing for the health workers, as the frontline workers, is to have sufficient knowledge on any disease, to have sufficient knowledge on any disease. Because it's through this way, then they will not be panicking, they will not be afraid, and in a situation of panic, one can really make a mistake. Therefore, it's very, very important. Knowledge is actually the best defense to any infection. So every person must be able to know that. Maybe let me pause here and
Thank you so much. And
continue
Dr.
with
Sago
the-
Moses, is there anything you wanted to add?
Thank you very much. I think I would like to to add to what the Honorable Minister has said, and also to set this in a global picture where, as you are aware, we have almost 2.5 million people globally who have been infected by the disease, and over 150,000 people have died globally. And I'm happy that you are talking about health workers, because they play a very major role in the response. Now, as the Honorable Minister has said, in fact, in some countries, we've had over 3,000 health workers becoming infected, and about 22 of them dying. The number of health workers who have been infected, in some estimates, between about 10% of health workforce who have become infected. So we are talking about a situation that is so serious, because the health workers are the gatekeepers, the front line in this response. So if we lose them, then we are losing the battle. Therefore, protecting the health worker is so important. And this has so coincided with the World Health Day's theme for this year, which focuses on celebrating the nurse and the midwife, the health workers who are helping us, and particularly in the era of the COVID-19. Now, if you look at some of the challenges that the health worker faces, you should look at it along the path of the response. In this response, we have about 5 key strategic areas we are addressing. First, we are identifying the potential cases. We are testing them. We are isolating them. And then we are treating those that we isolate, and then we trace, so what we call the contact tracing. You will see that in all these 5 stages, the health worker is there. Now, at a time that we are saying that everybody should stay at home, we are calling on the health worker to come to work. And the health worker is coming to work, but is coming also into contact with the virus. Because in all these five strategic stages, the health worker is meeting the virus in one way or the other. Therefore, they need to make sure that the health worker is protected. The Honorable Minister talked about the fact that Now, this health worker may be overwhelmed. Already, we don't have enough, so we cannot afford to lose any. So the little that we have, we need to make sure that they are given all what it takes for them to feel comfortable and confident in providing their services. So we need to give them all that is required. Because failing to do that, already they are overworked. At this time, the hospitals and the clinics have many more cases. Now they also have psychological issues. Imagine a health worker attending to a patient, you do everything, and you lose the patient. The effect on you is so much. So we need, and then thirdly, the health worker is also facing a risk of getting infected. Now the risk to him or herself, to the family, and also to other patients that the health worker may come into contact with. So if one health worker becomes infected, the chances of infecting many more people is very high. And let me bring it a bit home. You know that of the 16 cases we've had, I think we've had about 2 that were health workers. And we know how that they had to interact with many people. And so contact tracing for them was quite extensive because of the nature of the work. Therefore, it is in our own interest to make sure that the health worker is taken care of and protected. And I dare say that the health worker is in the front line, but we have others who are also on the front line. We have the security forces who are helping us at the point of entry. We have, can I say that our journalists are also on the front line? You are always, talking with people, etc. And there are many others who are on the front line. But we are focusing on the health worker because in all the 5 strategic stages, they are there. And they are there confronting the virus.
Thank you so much. I know you have answered part of the question that I'm going to ask now. Now, can you kindly give us an overview, just an overview of the global infection rate and how this affects the health workforce?
As you said, I've partly answered that, but the magnitude of the problem is that it cuts across, and it's over 200 countries, so it's almost everywhere. And because the numbers are so huge, over 2.5, we are getting to about 2.5 million people. So a health worker called upon to work under such a condition will certainly be overwhelmed. And this is why a health worker who burns out then affects the quality of service that the health worker is providing. And that's what we don't want. We want to make sure that the health worker is providing the best care. Because that's why you went to the hospital, to be given the best care. So we want to make sure that the numbers that go to the hospitals will not overwhelm the system. I dare say that even in countries where they have very good systems, health systems, this pandemic has caused them the systems are crumbling. Therefore, in developing countries, we have a more challenging situation to deal with because the systems are not as strong. And maybe it's also good to say this is why we're talking about social and physical distancing to ensure that we stay at home so that the health worker can stay at work. And the reason is that we do not overwhelm the health system. We get the best care when we need the care at the facility. So the numbers would have effect on the quality. Quality of service we get as patients when we get to the facility, but then even affect the lives of the health worker, emotionally, physically, psychologically, and then putting their own lives at risk. Therefore, the protection of health workers are things we do not only for them, but we do also for ourselves. Because if they are secure, we are protected.
Thank you, Dr. Saku Moses. Dr. Shangula, are we protecting our health workforce enough, and how are we doing that?
Yeah, thank you very much. Maybe before I come to that question, I would like to contextualize what Dr. Charles have said. He mentioned about, you asked about the magnitude of COVID-19 in the world, and he mentioned the figure of 2.5. Just imagine the figure of 2.5. That's what? That's the whole of Namibia. That's the whole population of Namibia, which is already affected by COVID-19. Just imagine a whole Namibian population. That's the situation in the world. Now, the other point I also wanted to allude to is the social support. Dr. Charles mentioned that the health workers, they also need our support. Not only our support, but they also need our understanding. Mm-hmm. Working in the health sector is a very depressing job. Mm-hmm. We are all human beings. Health workers are human beings who have got their own families, who have got the same emotion as everybody else. But they have chosen that profession. But they are not working in a very friendly environment. And that's why the understanding of the public is also important here. Now imagine that sometimes health workers are being accused of not being passionate, not being compassionate, not being, not having empathy towards their patient and clients. It may be so, but it's also a very difficult and depressing environment in which they are working. Now imagine a nurse coming, just seeing somebody dying in her hands, covering that body of the person who was in her hands, covering the body of that person who have just died, moving away and being encountered by a person, a public person who may not even be a patient, not with a very friendly, not really a friendly encounter. Obviously, the sum total of that emotion, having seen somebody dying, it's still there. They are human beings. And therefore, it's also important that whenever you meet them, you must understand the background where they are coming from. They must have just seen somebody dying. And as human beings, they will be attached. And also in that case, they will need your understanding. That's why the psychosocial support to the health worker is critically important, because behind the scene there, something is happening. Now coming to the question whether we are protecting them enough. As I mentioned earlier, the first empowerment of any health worker start during the training. It's during the training that the arts and skills of being aware of the danger of the profession in which you have chosen is inculcated. It must be done during the training. First of all, theoretical and also during the practical. Although during the practical, there are different expectations rather than during the workplace, so that when the person comes at the workplace is already empowered. I have mentioned the fact that in some instances, unfortunately, we do not give the correct induction to our health workers when they are assuming duty. There will be induction in the do's and don'ts, but really not so much on how to protect yourself against the infection, against the dangers of the profession which you have just assumed. Again, not only that, you will also need to provide things like gloves. You also need to provide things like masks. And also in the time of coronavirus, you also have to provide all the necessary protective equipment. But as long as if a person is not well grounded in the theory and practice of risk reduction, whether you give gloves or whether you give gowns, it may not really serve the purpose. But the critical point is the empowerment in terms of knowledge.
Thank you very much. And talking about the right clothing or the right protective clothing, Dr. Saku Moses, there has been a global shortage in PPE supplies. Now, I wanted to know, can you tell us how will WHO and the UN, how does
through UFP so at every junction, health worker needs that Zoom, etc. To do that. We are working in to
They are coming from. They are as workers.
The Honorable of Health and Social Services, Alumbi Shangula, the Inspector Bastian, the Price CEO Forum Chairperson, Madam Rosalia Mas.